Hey everybody, it's Dr. Ashley, Pediatric Emergency Mom. Continuing in our series of conversations with kids, I was going to broach the topic of drugs. Ooh, I know. It seems like, especially, if you have little kids, like less than 5, 6, like, why do we need to talk about drugs? But I do think it's important, like all of these other topics, to start early kind of talking about these things. As soon as they can read, um, if you're just going down the street, down the interstate, there are signs. If you are addicted to drugs, call this hotline. And that is how I got my first question from my kids about drugs. What are drugs? And mom, what are they talking about? And I found myself initially, sometimes there's simple little innocent questions. I have a really hard time answering these questions. And so I think I remember saying, like, well, drugs are medications that people don't use the right way. And then I thought, no, that's like half right, right? Because all medications are drugs. The word drug comes from the Greek pharmacon, I think. So all medications are drugs, but not all drugs are medications, right? Is that right? Did I say that right? All medications are drugs, not all drugs are medications. Yes, okay, that's like wrap my mind around it. And so drugs, in the bad sense of the word, right, are things that can be abused. So these are substances that can have a positive effect on the body, like a medication, like an antibiotic when we need, if we have pneumonia or an ear infection, or it can have a negative effect on the body, especially if it becomes something that somebody's abusing, something that somebody's addicted to. And so in the news, and if your kids are, if you have the news on, or your kids are hearing this, that, they've probably heard about fentanyl, right? That's been in the news quite a bit. And so that's something I've talked to my kids about already. And so fentanyl, and I've told them, is an opioid. So opioids are made from the poppy flower. And they act on certain receptors in our body that make us kind of euphoric and feel kind of nice, right? But they are very habit forming, and can become drugs of abuse. And so in the hospital setting, in the medical setting, they are medications, right? We use them for broken bones. We use them for burn patients. We use them for cancer patients. They're safe when dosed appropriately. But in the recreational setting, then they become drugs. So then they have the negative effects. And fentanyl especially, is 100 times more potent than its kind of counterpart of morphine. So fentanyl, though, is a synthetic opioid. So it's something that's been created and does not show up on a urine drug screen. So this is something I've talked to the kids about. Like, you'll hear it in the news because people are starting to make it illegally and they're starting to sell it. And you'll hear stories about people who accidentally inhale it or touch it and then put their hands close to their face. And then they get that substance in their body and they need a specific kind of medication. And so we've talked about that. We've also talked about things like marijuana gummies. And so you may be thinking, Ashley, you are insane. My kid is 8 years old. Why are we talking about this? Well, an 8-year-old maybe goes to a school where there are 12 or 13-year-olds, right? If it's elementary to 8th grade. Or if it's a school that's all the way to high school, they may be interacting in some way, shape, or form with 15, 16, 17-year-olds. And what is seen in the emergency setting is a kid comes in and all of a sudden, they were fine when they went to school and then they started acting odd and then they became like minimally responsive. And a lot of the time what's happening is another kid brings a marijuana gummy to school and just asks another kid, like, hey, do you want a piece of candy? And this is what happens. And so specifically for that, for my kids, like I tell them, do not eat candy from anyone. And then that became like, whoa, 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 mom, candy, mom. And so we kind of dialed that back. And I said, well, okay, you can have candy if it's your good friend, right? You know this person, it's your good friend, and you saw them open the bag of candy. So it's a sealed bag, you saw them open the bag. And I realized that might be a little bit extreme, but realized like the things that I've seen in my career are extreme. So I'm gonna take those extra precautions with my kids. But anyway, this is just an intro in the topic of conversations with kids to talking to your kids about drugs. Pretty soon I'm gonna find a lighthearted topic to talk about because these have all been pretty serious. All right, thanks.